Welcome. Every year, close to 60,000 people are diagnosed with Parkinson's disease, a neurological disease which, put simply, affects one's motor function, making it difficult to move. Right here in Toledo, we have one of the nation's leading Parkinson centers, the Gardner McMaster Parkinson Center. There, we spoke with Dr. Lawrence Elmer, one of the center's leading experts. Today, we will discuss Parkinson's in depth, the signs, causes, and treatment that are available today. Because Dr. Elmer was so willing to share so much of his knowledge, we have split our discussion into two parts. Please enjoy this first special episode of Time Waits for No One. Good evening. Tonight we are going to focus about a different subject. We heard from many people they want us to talk about it, which is Parkinson's disease. And definitely it's my pleasure to welcome the director of that center, which is Dr. Lawrence Elmer.
Thank you so very much, Dr. Kabour. It's really an honor and a pleasure to be with you today.
You know, our program focuses on educating the public. And the most common misunderstanding is what's Parkinson. So we want you to start with that simple definition. What is Parkinson's disease?
So many people wonder, you know, if they've been given a diagnosis of Parkinson's disease, what does that mean? What does that mean to me? What does that mean? What's wrong with my brain? We say by definition, Parkinson's disease is characterized by an inability to initiate and maintain movement. Our brain uses many different chemicals to communicate from one nerve cell to the next. But one of the chemicals is called dopamine. And dopamine I always think of as very similar to WD-40. You know, we always think if we've got a rusty bolt or a squeaky wheel, we just squirt in a little bit of WD-40. Well, very similar to the Tin Man in The Wizard of Oz, if you don't have enough dopamine, WD-40, you tend to rust up. And so when he was standing there and Dorothy passed by and he said, "Oil can," then that's kind of what our brains are saying when we have Parkinson's. We need something, we need more dopamine. And in his case, she just squirted the oil into his joints, and of course then he started moving around very well. Well, we take a different approach. We replace the dopamine in the brain using different types of pharmacological agents, either pills or patches, sometimes even subcutaneous injections. There are so many treatments that are available to correct the dopamine imbalance in the brain so that people can literally go on living completely normal lives. One of the other real breakthroughs, I think, in our understanding of Parkinson's is that exercise does as much for the disease as the medications do. Sure. In fact, we always say exercise plus medication, it's not 1 + 1 = 2, it's 1 + 1 = 5 or 7 or 9. We're realizing now that the brain is so adaptable and so willing to learn new things. Given the right instruction, the brain will actually develop new pathways that literally bypass the area that's damaged. Our goal is to really get it to the point where the people forget that they actually have Parkinson's. So one of the greatest rewards is when someone comes in and they say, Dr. Elmer, I was out doing such and such, and I completely forgot I had Parkinson's.
That's wonderful.
And I just jump for joy because I think that's our goal, is to make this almost as if it's not even there.
To make a better understanding for Parkinson's disease, the people have a specific question, which is actually it was sent to us by patients, and I want to ask you, since you are the expert in the field. So the first one is, what are the causes of Parkinson's disease?
There's been so much research into what actually causes Parkinson's, and while we can't say there's one single cause, there has been tremendous advances in research in understanding that it's probably something in the environment that triggers this. And here's the key. About 15 to 20 years ago, a group of researchers discovered that a genetic form of Parkinson's, and in an indirect way, through that familial Parkinson's, we got the first clue. a part of the DNA that actually got made into a protein called alpha-synuclein. The alpha-synuclein is the protein that actually is damaged in Parkinson's and then seems to spread throughout the entire nervous system, causing damage to a whole group of nerve cells, including, and most especially, the ones that contain the dopamine. Sure. How did we figure out that Parkinson's was probably caused by an environmental factor? Well, as it turned out, once they found out what this protein was, this alpha-synuclein, they developed specific markers for it. So they could see it clearly under the microscope. They could see where the alpha-synuclein was starting to malform and actually stick together and literally clump up inside the nerve cells. Well, nerve cells, it's very, very important for nerve cells to be able to move it from one area of the nerve cell to another. And this alpha-synuclein was starting to obstruct that movement, eventually, unfortunately, leading to the death of that particular nerve cell. Because nerve cells are unique in the sense that they take a bit of information, an electrical signal from one part of the body or one part of the brain, and they deliver it to another part of the body or another part of the brain. So with alpha-synuclein blocking all these nerve cell pathways, progressively nerve cells were damaged and actually died off. Interestingly, everything that we breathe passes over the olfactory bulb. Everything that we eat and drink, food, liquids from the external environment, pass over the lining of our intestines. And this is where we started to see the very first areas being damaged. The nerve cells in the intestines and the nerve cells in the olfactory bulb had these clumps of alpha-synuclein, and those nerve cells were dying. Well, what makes it more complicated is because these clumps of alpha-synuclein could actually move in the nerve cell from one place to the next, they were obstructing some things, but they would also move themselves. And as a result, they could move to the very end of the nerve cell. And one of the characteristic features of nerve cells is when they communicate with the next nerve cell, they release a package of information. We call them nerve chemicals. Dopamine, for example, is a nerve chemical. Well, they release these nerve chemicals into the external space, the space between the nerve cells. Well, guess what else gets released into that external environment? Those clumps of alpha-synuclein. And again, the very nature of nerve cells are that in addition to releasing these little bits of information, and in some cases pathological alpha-synuclein into the environment, the microscopic environment between the nerve cells, these nerve cells also take up bits of information. They take up chemicals, and in a sense, they can also take up in and internalize the damaged alpha-synuclein. So now we have a situation where the alpha-synuclein, which starts in two separate locations, the olfactory bulb and the intestine, is then transported up to the base of the brain, an area we call the brain stem. It's released into the space between the nerve cells, taken up into the next set of nerve cells, and what happens next? That damaged alpha-synuclein starts to corrupt all the good alpha-synuclein in that next set of nerve cells. So now they start to become damaged, and the process just continues and continues and continues. Now we know that there's something in the environment that triggers it. The nerve cells, once they're damaged in these two distant locations, then transmit this damaged protein from one nerve cell to the next. And so it continues this long-term, indefinite march all the way up the brain, eventually damaging the nerve cells that contain dopamine. Then and only then can we make a clinical diagnosis of Parkinson's. But as you can imagine, a lot of damage has already occurred. So now we refer to this as the pre-motor Parkinson's. The pre-motor Parkinson's involves all these pathways that are being damaged before the dopamine nerve cells are damaged. Once they're damaged, we actually see the classic signs and symptoms of Parkinson's. And what are those? Slowness of movement, lack of facial expression, sometimes difficulty swallowing, difficulty getting up out of a chair, difficulty with handwriting or other fine motor skills, a loss of dexterity, a loss of speed and fluidity in movement. They can also develop the classic rest tremor of Parkinson's, but this is where it gets really confusing. Not everybody has a rest tremor, but almost everybody with Parkinson's, 98 to 99% plus, have stiffness and slowness. That alpha-synuclein damage that's being passed on from nerve cell to nerve cell can continue to progress, and in some cases actually go to the very top of the brain, where our memory, our thinking, our problem solving, all our judgment, our vision, everything that makes us human beings, our language skills, all of that can also be affected. Thankfully, that is relatively rare and happens only after years, if not decades and decades of the disease.
It's time to change your future with Toledo Cardiology Consultants.
What will your tomorrow look like? Will you be quick enough to throw a football with your grandchild? Will you be strong enough to embrace every moment? Will you grow old with vitality and joy? Or will you get old with heart disease? It's time to decide. See your doctor. Get a plan. Come on, guys, you can do it. Because remember, time waits for no one. Early diagnosis of Parkinson, even before the motor symptoms, which is most of the people feel the tremor, the rigidity. If there's any clinical signs, which is the patient can notice it or the other physician can notice it, to start the process of early diagnosis before they get into that brainstem and those clumps of protein, which is leading to the disaster of the disease.
This whole concept of actually identifying a premotor Parkinson's is probably one of the most exciting developments I've ever seen in my entire life. Why? Because it gives us the chance to intervene before people actually come down with the classic symptoms of Parkinson's. And what are some of those premotor symptoms? Well, as you can imagine, if the olfactory bulb is damaged, their sense of smell can actually go away. So another one, which again comes back to the early stages, is a change in bowel habits, a slowing of the bowels working, so that these patients in mid to late life actually develop severe constipation. Now, you and I know that constipation is pretty common as we get older, but this is a form of constipation that's not related to normal aging. It's actually related to damage to the nerve cells that allow our intestines to move food through our intestines, digest the food, and eventually excrete it. Changes in cardiac rhythm, which as a cardiologist you would be very familiar with. There are changes in the heart rate when people move, they change their position. Well, as it turns out, in Parkinson's disease, that normal variability in heart rate that we see with changes in position, that absolutely goes away, because the nerves that normally control that pathway to the heart are damaged. Other things that they're looking for are changes in sleep habits, and that's what's called REM sleep behavior disorder. This normally, when we dream in our sleep, when we're in a very deep sleep and we're dreaming, our muscles are completely paralyzed. So if you dream that you're fighting or you're running or you're shouting or you're talking, you don't make any movement at all, maybe a little flicker of the eyes back and forth. We call it REM, which stands for rapid eye movement. It's almost like they're at a movie theater watching something on the screen. Well, that paralysis, that switch, that nerve control to control the muscles during the dream state in premotor Parkinson's is actually damaged. And so one of the symptoms that we look for or ask about when we're considering a diagnosis of Parkinson's is usually to the spouse or the partner or whoever's with them, family member. Does your loved one talk a lot in their sleep, or do they move or thrash around? I had one professor from Bowling Green who was a math professor, and his wife said that he gave a geometry lecture in the overnight hours. His profession. She said it was the most boring lecture she ever heard, but he was giving the lecture because he was dreaming that he was giving the lecture. And amazingly enough, some of them will go on to act out their dreams. And it's dangerous, not only for them because they can thrash around and literally injure themselves, but also it's really quite dangerous for the bed partner if somebody's in bed with them because they may take a hit. We believe that these premotor symptoms are going to allow us to screen people and identify individuals who are at risk or possibly are even en route to developing Parkinson's. They just haven't developed the classic signs and symptoms. Why is this so important? Because after the damage has occurred, it's very, very difficult to get brain cells to recover, and they really don't even grow back. Most of our brain cells aren't able to grow back once they're damaged, irreversibly. But if we can identify people who are en route or developing Parkinson's, and we have some treatment, whether it's a pill or a shot, and you could give the person that treatment, and literally, Dr. Kabour, possibly they would never, ever develop any further damage to the nerve cells, and most importantly, never ever develop Parkinson's. That would be a breakthrough. That would be life-changing, and quite honestly, I hope it happens in my lifetime because then I can retire and be a very happy man in my retirement.
Which is really bring me to the question about the progression of the disease. Most of the misunderstanding of Parkinson's disease that as soon as you tell someone you have the diagnosis, they think it's the end of life, that tomorrow they are going to die, they're going to be disabled. I mean, we just want to shed the light how slow progression of disease is Parkinson. I mean, and give the hope to the people.
This is, of course, a devastating diagnosis to hear for anyone, and whenever I have to share with them, I see them clinically, and I recognize the signs and symptoms that are so classic for a diagnosis of Parkinson's. I always tell people I have good news and I have bad news, and then I ask them, what do you want to hear first? And if they say the bad news, I say, well, I have to tell you, you have Parkinson's. But then, without even catching my breath, and the good news is that you have Parkinson's disease. And then I go on to explain that literally in our generation, we have seen a complete transformation of the management of Parkinson's disease. We can treat the symptoms of Parkinson's so successfully, and again, I always have to put in that disclaimer, not everyone does as well as the majority of our patients, but the vast majority of our patients live lives to the fullest. The medications are extremely effective, and we have many to choose from, so we can almost always find either one or two or three medications in combination that provide extreme benefit and virtually no side effects. And that's the key to managing Parkinson's, is to literally reverse the disease process as far as the symptoms are concerned, and then prevent them from having side effects, which in some cases can be more bothersome than the disease itself. So If we take a patient who is newly diagnosed with Parkinson's, the first thing I tell them is, I usually say, I want you to know that the chances are very, very great that you will not pass away from Parkinson's. It used to be that Parkinson's was truly a life-threatening illness. And back when it was first described 200 years ago by Dr. James Parkinson's, the average lifespan of someone with Parkinson's was only about 5 to 7 years. It was a very, very devastating illness. Most of our patients now live a full and complete life. Nowadays, it's not uncommon that the vast majority of patients with both Parkinson's and MS come in and they just stroll right in and they stroll right out and they live completely normal lives. So we're very excited because we do believe we have a lot to offer people, not only from a medication standpoint, but most importantly from a hope standpoint. In fact, we have a saying in our clinic, the most common prescription we write is a prescription for hope. So we offer a lot of hope, and we have so many different options available. There is a group of complications of Parkinson's which we refer to as non-motor complications. They involve other parts of the nervous system, and we even have treatments for those. In fact, the FDA newly approved a brand new medication. We referred to it as pimavanserin because that was the generic name. And it's not uncommon that some people with Parkinson's, either because of the disease or the medications or a combination of the two, will actually start to see things that aren't there. We call them hallucinations. Sure. It's almost like you're dreaming but you're awake. You're seeing something that's not real, but the brain makes you think it's real. Well, as it turns out, this brand new FDA-approved agent actually blocks the areas of the brain that cause the hallucinations.
Shelley Cones has been a Parkinson's patient for nearly 10 years. She also happens to be a patient of Dr. Elmer. Shelley's taken some time to tell us what her life has been like since her diagnosis.
How are you, Shelley?
Great, thanks.
Good. Now, can you tell us when did you hear about the diagnosis of Parkinson's?
It was in 2006.
Mm-hmm. And what was the symptoms you started with and you end up basically having the diagnosis later?
A tremor in my right arm, and I was getting injections from an orthopedic surgeon for nerve impingement, so I thought it just had to do with that. And I finally said to him after months, when will my shaking stop? And he said, what do you mean? And I showed him, and he said, oh, that's not got anything to do with your nerve impingement. And he said, you need to get to a neurologist. And I said, well, what do you think is wrong? He said, well, I think it's Parkinson's, but you're so young.
There's a lot of people think that Parkinson's is only for the elderly patients, but too many young people really, like you, who develop the disease at that stage. And when you had the diagnosis, how did you receive that news? I mean, was it shocking to you?
It was, but when I was told I had it, I certainly wasn't expecting that diagnosis.
Sure. So when they made the diagnosis of Parkinson and you were having the back pain and the management for your pain, did you have the back surgery after the diagnosis?
Yes.
Or after the diagnosis,
yes.
Did they tell you because you have Parkinson probably we shouldn't do the back surgery?
Yes, initially.
Initially.
Because everybody just, I guess they must think you have a short life term or something. But I have found a surgeon and he did it and it made a big difference.
Great. I mean, because actually Parkinson is not a limitation. Like what you said, probably we need to own that disease, not
absolutely,
really the other way
absolutely. And I don't let it define me.
Exactly. It's not the end of the world.
Right, exactly.
Right. And when you got the Parkinson and you start having the symptom, they started the treatment. Can you tell us something about some of the treatment which you had?
Well, I switched to Dr. Elmer, and he started me on a few low-dose things, kind of cutting edge, I think some of them are now. And within probably 6 weeks, most people didn't even know I had Parkinson's.
Good. So it's mainly medicine, or you also, I understand Dr. Elmer emphasized a lot on dieting and exercise, and I assume you are probably one of those people who follow that?
I try. My diet's probably not been that good lately, but I try.
Okay. What about exercise?
Exercise, I do a fair amount of. I fish, I walk, I I surfed a few weeks ago in Costa Rica.
Good for you.
So I just try to stay active, and you know, the more active you are, the better you do feel. So.
Good. So you go for surfing, you go for every outdoor activity you like. I mean, there's nothing stopping you. Technically, you're living normal life, exercising normally, going out with your friend normally, which is really, that's...
nothing's changed.
That's
I mean, most of my friends will say, I forget you even have it.
That's good. That's good. What do you think the future is going to bring you, I mean, from Parkinson's treatment standpoint? Do you have any hope for any breakthrough treatment going to happen?
I'm not nervous at all. I think with Michael J. Fox having it, Muhammad Ali, Janet Reno, it's brought the awareness up and a lot more research going on. So I'm encouraged. I'm encouraged that I've had this for 10 years and I've really had little change.
That's great. That's great to see, because most of the patients really, when they look or hear about Parkinson, they get so scared about it. I mean, I'm glad that you have that mentality, I mean, which is tremendously helpful for the future, and there's a lot of things coming, I understand, and that's really very good news.
It is, but it's not a death sentence. I mean, people get, I watch people and they say, and they go into a shell and they pull back from everybody, and it's not a death sentence. There's so many things that are worse. The saying that I like the most is, I have Parkinson's, it doesn't have me, and that probably goes with every disease, and if I could change anything, I would knock the word disease off, because to me it's just, it's
not a disease.
Right, exactly.
That's a good way to put it. Thank you so much.
Thank you.
Thank you for watching. We will conclude our discussion about Parkinson's with Dr. Elmer on our next episode. If you missed part of this interview or wish to watch any of our previous episodes, find us on YouTube by typing in Toledo Cardiology Consultants. Until next time, stay healthy, because time waits for no one. Good evening.
Get caught up and educated with past episodes of Time Waits for No One. Go to YouTube and search for Toledo Cardiology Consultants to find our channel. Then click to subscribe so you never miss an episode.
Remember, time waits for no one. What will your tomorrow look like? Will you be quick enough to throw a basketball with your son or daughter? Will you grow old with vitality and joy, or will you get old with disease? It's time to decide. See your doctor. Get a plan. Come on, guys. The ball is in your court, because time waits for no one.